How is it best treated?
So the mainstay of treatment is either laser or eye drops. And if we make a diagnosis in the clinic and a patient does not have any cataracts, then that's usually what we'll do. We'll recommend a painless laser procedure called SLT, or we'll recommend eye drops. And the goal of all of these treatments is to lower your eye pressure. Usually we're looking for about a 20 to 30% pressure reduction from where you are normally. But it varies based on how bad the glaucoma is, and so some of our recommendations change based on how bad it is, but that's a general rule of thumb.
And do eye drops work really well?
Eye drops do work well. The problem with eye drops are several. One is cost, and because it's not a cure, it's an ongoing treatment, and you have to take your drops every day for them to work. So it can be a real challenge over the years to get these drops in and day out. You know, going to the pharmacy every month, paying co-pays and all that, it can get frustrating for my patients to do that. And so that a lot of times we're looking at other ways to treat it aside from just eye drops. Some of the eye drops have side effects, and they can be expensive. They can cause a red eye. They can cause some other problems. So we're always looking at other safe surgical options too to eliminate the problem or reduce the risk of progression that doesn't involve doing an eye drop every day.
So Dr. Foster, why did you think that combining glaucoma treatment during cataract surgery was a good choice for dentists? That sounds like a lot of stuff.
Well, the beauty of these procedures is they are very quick. Cataract surgery takes typically 6 to 8 minutes, and combining it with these other glaucoma procedures adds just a few minutes. So it's very safe, and it's just an extra way to benefit him in terms of reducing dependence on eye drops and just making sure, like you said, if he misses a drop or anything like that, that he's going to be protected. So the procedures we did were bladeless laser cataract surgery because that was something that was affecting his vision. So we corrected that. We corrected his astigmatism, so he's seeing very well without glasses for distance. We did 2 glaucoma procedures. One is called ECP, and it's amazing technology. It's basically a little fiber optic camera that you can actually put within the eye, and there's a laser that treats some of the tissue that produces fluid within the eye. So if I like the kitchen sink analogy. With glaucoma, you have a faucet and a drain. With that procedure, I turned down the faucet. And then the other procedure we did was called the eye stent, and that's a very recent development. It was FDA approved just a couple years ago, and it's basically a way to increase the drain.
Yeah, now that the state of Florida is looking at legalizing medical marijuana in the state, I'd like to get your opinion on how you feel about marijuana as a treatment for glaucoma.
Well, that's a great question. The interesting thing about marijuana is that there is some in vivo efficacy in lowering eye pressure, but one of my glaucoma professors during my residency, that was the favorite question we like to ask him. But the problem is with marijuana, it's really not a very good glaucoma drug. All of the other FDA-approved drugs that we have available are much more effective, much more long-acting in lowering eye pressure than marijuana. And even some of these surgeries that we're talking about are even more effective than the drops because you don't have to keep taking them over and over and over. So, and I've talked to several glaucoma specialists about this topic, and the consensus that I found is basically it's an interesting curiosity, but it's not going to be a recommended glaucoma treatment for lowering pressure just because it's not that effective.
You get the ECP treatment if you can get it if you don't have a cataract. And how does it affect you having to take glaucoma drops?
What was the second part?
How does it affect you as far as glaucoma drops? Will it eliminate the need for those? Oh,
great question. So the ECP is not typically done without cataract surgery, just because there are other lasers that we can do, like SLT, for instance. So in general, if a patient does not have the need for any other intraocular surgery, then we would do something like laser, not go in the eye with the ECP. So that's my general rule of thumb there. As far as the drops, the goal for a lot of these procedures is to reduce the need or eliminate the need for eye drops. In the FDA trials with the eye stent in particular, about 70% of patients were off of eye drops 1 year after the surgery. So that's really good, compelling data to me that a lot of my patients I'll be able to get off drops. Typically I'm very conservative, so often early on I keep you on drops, and I essentially until we're off all of the other medications after the cataract surgery, because I want to make sure that everything's behaving before I just say stop the drops altogether. But that's really great data long term from the FDA, so I'm excited about that.
I'd like to know if you can get the eye stent even if you don't have a cataract.
So similar to the ECP laser, the eye stent is actually just approved for patients that have a cataract. And it's the same rationale that you're going into the eye to do a cataract. It's a good time to do any other work while you're in there, but it's actually not FDA approved at this point for procedures by itself without a cataract. So it doesn't mean you're out of luck. That we have other procedures like, for instance, SLT, that it's very safe and effective in patients that don't have a cataract. So that's a great question, though.
So Dr. Foster, why is this new technology so beneficial to glaucoma patients? And also, what is the prep for that surgery? I know it was easy once you got that IV going,
Yeah.
but
Yeah.
is there prep for that?
The only preparation is a visit to see us, where we do a comprehensive eye exam and we determine what we need to do. And then an eye drop a day before the surgery and the day of the surgery. And then there's a lot of drops afterward to heal from a cataract. And then just a few follow-up visits. Typically we'll do two post-operative visits. But what I love about my field and what I love about this new technology is that we're getting better and better, improving our patients' quality of life. And that includes reducing need for eye drops, assuaging fear about missing a drop, and Dennis described that beautifully, and also improving vision and just making patients less dependent on glasses, less dependent on eye drops, and we can do it all fortunately in a very short period of time, and it's very safe. So it's a wonderful time to be doing this, and I feel really privileged to